Okay, so this podcast is just heating up big time as I have this amazing guest today on the Sexy Aging podcast. I'd like to introduce you to Dr. Rebecca Lewis.
Hi, it's lovely to be here. Thanks for asking me, Tracy.
Yeah, no, I'm really excited. I've been kind of stalking you a little bit because after I introduced Amanda on a podcast a couple of weeks ago now, and she mentioned that we should connect, but I had already downloaded your app, Balance, the one that you're involved with, and I have been tracking the documentary that features Davina McCall in the UK. And obviously I'm on the opposite side of the world, so not able to access the documentary, but I've been tracking what's happening. And I think what's really cool is the acceleration of the conversation around what's happening to women as they age through midlife or their third stage. And then you came into the conversation and now here we are. So I think we're all wanting to get on this platform to really help women. That's what we're here for. Yeah, completely.
Yeah, it's such a unmet need. Women's health in this age has been neglected for decades, and it's got to change. It's really, really damaging women's health, and raising awareness is so important. And we're trying to do that with the Menopause charity and do that globally. So it's lovely to talk to someone in New Zealand.
Yes, thank you. So I'd like to just give a quick overview. You're a mum. That's our connection. And then just before this podcast started recording, I've got, my child coming in and out. This is how we do it. Yeah. And you love to run.
Yeah, I'm a keen runner, and do that. It's really important for me, for my mental health, physical health. It's just brilliant.
Yeah, so while you're running in the UK, I'm running in New Zealand, so we've got that connection as well. And the same reason, it used to be I used to use running to help me maintain my calorie intake, which is terrible, right? But now I do it for the mental health reasons. I do it because as I'm running along, I'm solving a lot of problems. I'm thinking about, what's going to happen today. So it's really nice. And you are a GP with a special focus on menopause. So if I could hand it over to you so you can help us understand, what does that mean and how do you help women?
Yeah, so, I'm a doctor and anaesthetist to start with, and now a general practitioner, and became menopause specialist in the last few years. And now I practice solely in Houston Health menopause clinic. I'm a director there, and solely see menopausal women actually, and it's probably one of the biggest. I think it's the biggest one in the UK or the world, even, because there are not many around, unfortunately. So we see a lot of women with the same problems universally that have been neglected, and that's my passion now, really. Louise Houston has been a real pioneer in the menopause world, and really has been responsible for us all talking about it over the last 3 years. And hence, thank goodness, the conversation has got going, because it's been a terrible taboo, still is, still a lot of work to do, terrible taboo, and so many misconceptions about the menopause itself. It's shrouded in secrecy. Previous generation traditionally did not talk about it. So women, very highly educated women, come to my clinic and have not got a clue what's happening to them. So it can be incredibly difficult time for women, and frightening time, because these things can be very insidious in onset symptoms, and can be devastating for some women and frightening, and they worry they've got a brain tumor or dementia. So increased knowledge is absolute key. Dispelling myths and discussing good treatments are really, really important, I think. So I'm delighted to be here to have that opportunity to talk and hopefully help a few women if I can. That would be brilliant.
Yeah, well, you've got all the information that I am seeking. So I just wanted sort of to put myself on this conversation and say, I am not the expert in menopause. I've said that many times through the podcast. I am a connector, the person that goes, hey, look, I know someone who can help you. And it's always been around trying to get some information and insights to help my fellow woman going through the situation as me. So I am a menopausal woman and I'm in fitness. And quite a few years ago, I started looking into what was happening on the hormonal front. Like I knew things were happening, but I couldn't figure out all the symptoms, and there just seemed to be so many random things happening. So I want to ask you, like, what can you break it down for us, like the things that we should be looking for, and around about what time of our life? Because I remember probably some of the first symptoms hitting me around 45, which most people would seem as like, oh, that's quite young. Don't you get like menopausal when you're like in your 50s? But I really did notice some things happening and I couldn't figure it out. And I guess I put it on the back burner, like, oh, I've just had a bad sleep, or I'm a bit tired, and also have a young child. So, you know, there's those things that you're just sleep deprived, right?
Yeah, you've summarized it really well. For a start, let's talk about what is the menopause. I mean, it really is, officially, it is a year and 1 day after your last natural period. So it's a look back in time diagnosis. The peri-menopause is the time leading up to that. And that can be 10 years before your actual last period. So the average age in the UK of your last period is about 51. So menopausal symptoms or perimenopausal symptoms can start from early 40s. But actually, 1 in 100 women will reach menopause under the age of 40, and 1 in 100 is not that rare. So women in their 30s, and we're seeing increasingly higher numbers of women in the younger years as a result of cancer treatments, which have been successful in treating their cancer, but it has damaged the ovary. So not only is fertility damaged, but they're put into a premature early menopause. So one of our youngest patients started her menopause at 14. So it can affect all age ranges. So that's the important fact, number one. The classical age of your last period is 45 to 55. But it's very variable. And what happens, we run out of eggs. We're born with so many eggs in the ovary, and we run out of them. And as we run out of them, the ovary fails to produce these vital hormones for women: estrogen, which is the most important one, progesterone, and testosterone. Well, they're all very important, actually. But these hormones begin to fluctuate and decrease in their production. And as they're sort of decreasing, the ovary doesn't just wake up one day and then the next day it's gone. It doesn't just stop unless it's a surgical menopause where they're removed. It's just a very fluctuating, exactly that time for women as the ovary stutters to a stop, if you like. It's not a nice, elegant decline that you can predict. It's a stuttering stop. So the estrogen, the ovary tries to produce estrogen for a little bit, and it can be successful, and you can have quite high levels for a little while, and then they suddenly drop, and then they recover. And literally, if you look at a graph of a woman who is perimenopausal, which means she's still having her periods, but the hormonal function of the ovary is not as it was. It's up and down, it's chaotic, and it goes up and down, up and down. And this can make a woman feel chaotic as well.
Yeah, okay, so that was definitely something that happened to me, and you've explained it beautifully. So I think I did see that graph, and the first time I saw the graph, maybe only a month or two ago, I found it really confronting, because the spikes that just go up, down, up, down, up, down, up, down. And then it makes you go, oh, whoa, you know, when I was having regular periods and I would have PMS, I was aware of it. I became very aware of it and conscious of it. And, you know, I would feel agitated, and I'd probably snap at my husband and my kids. But then when I was perimenopausal, it was insane. I would say borderline psychotic. And because of that symptom in particular, I really felt like I kind of diagnosed myself as maybe depressed. But it was, I mean, that's probably, I think now in hindsight, an over-diagnosis, because I just didn't understand what was happening with my hormones. So that graph is really confronting, and I think it's almost like a relief to know.
Yes, yeah, it is. It's not your fault. And women don't recognize themselves. So if they've always had a little bit of PMS, which may not have been too bad, it will get worse with this massive fluctuation in their estrogen production. I don't know any woman who hasn't suffered to a degree of an increased amount of anxiety. And for some women, it can be absolutely dreadful. They become housebound, they have to give up their job, They can't go out of the house. They stop driving on the motorway here. That's a really common symptom. And they don't recognize themselves. They maybe have never suffered with anxiety before or low mood. So this is a very worrying, experience for them. The mood is down and flat. I describe it as a loss of joy, really, rather than clinical depression, which is a sustained low mood. Everything, the joy, the colour of life, the excitement of life vanishes. And everything's mundane. It's like walking through treacle, an enormous effort. The fatigue can be really disabling, similar to the fatigue you can experience in the first trimester of pregnancy. So people are feeling really exhausted, have to lie down. Everything is an effort, a mental effort and a physical effort. And they just lose this interest and loss of joy. So even if something lovely happens, they can't get excited and feel that lovely joy. Muscles are affected. Joints and muscles are really, it's so important. You must see that in your job all the time, how important it is to have your muscle mass and bulk. When we lose estrogen, the muscle density gets less, and it's something called sarcopenia, loss of muscle bulk, and so they become weaker, but painful and very tight and stiff. Turning over in bed hurts, and I think people think they need a new mattress, but it's not that. It's their actual musculature is all very tight. And actually, the joints can be very painful and stiff. So people quite understandably think they're developing an arthritis, and they put it down to aging. And it's not that. It's the estrogen effect. It affects our skin, our hair, our nails. Many women know that their hair gets dry, and their eyes get dry eyes, dry mouth. Palpitations are very common. It affects the electrical system in the heart. Bowel symptoms, irritable bowel often flares up. Nausea, reflux. Vagina is so important for vaginal and bladder health. So urinary frequency, recurrent urine infections. It's really important to have enough estrogen to have really good vaginal health, by which I mean to have nice blood supply to the vagina, thick vaginal walls with a good layer of lubrication on top. That's normal, healthy tissue. Without estrogen, the walls become thinner and we lose that layer of lubrication. So it can be very sore and painful with sex, but not only sex, you don't have to be sexually active. It can be very painful just wearing underwear for some women, or jeans. The external vulval area is very sore and itchy as well. And just some poor women, even sitting down, is uncomfortable. I mean, imagine that, how difficult that can be. So a myriad of symptoms and forgetfulness. People really worry that they're getting dementia, early onset dementia. They can't get the right words. They forget word finding difficulties, and they're easy words often. Their memory, they're constantly making lists. Thought blocking, they're in the middle of a sentence and they just stop talking because they can't remember the subject they're talking about. And it's embarrassing, at work or with your friends, in a social situation. You can't remember the word, then you have a nice, lovely sweat, sweaty everywhere. It really can be very, very tricky for some women. And
I think actually that you mentioned that one. Yeah. I think that is one of the scariest symptoms if you've got to stand up and present content, or you're doing a business presentation. I've got a few things coming up, and have stopped mid-sentence, and I feel like I almost want to start the presentation with, okay, so I'm a menopausal woman, so if I stop mid-sentence, let's just accept that and don't look at me weird, because I know what I want to say and I will get back on track, but it's just easier to put it out there from the beginning. Like, I would love to start like that, because I know what I'm talking about, but sometimes the thought or the word just doesn't come, and it's freaky.
I know, it's really freaky. And in front of your boss or whatever, it affects your confidence, wouldn't it just? And that's why 20% of people leave their jobs due to menopausal symptoms, 10% permanently. It's horrendous. And 51% will reduce hours, 51% will be off sick, 90% off for 8 weeks at least. That's the survey we did just recently last year on 1,000 women. So it has devastating effects on women, can do, not only on their personal life, their relationships with their loved ones. Often women feel very detached and misunderstood, can't express themselves properly. After being quite sociable, maybe don't want to socialise. It's an effort, and people are irritating you anyway. You get much more irritable in general. So even your lovely friends that been great friends with, you don't want to go out. So women become shells of their former selves, and that's really, really sad to hear that. Their vivacity, their love for life diminishes, and that's a tragedy. Why should that happen, and why should we put up with that?
Yeah. Hey, thank you so much. I mean, that's a huge amount of information to break down for someone who's maybe questioning, what's happening to themselves. I did an episode with my husband and we downloaded the 35, 36 symptoms, 36 symptoms, the most common ones. And I did a test on him and, for the podcast. Okay, so here's all the symptoms and you've got to say yes or no whether you think that I had them. He absolutely nailed it, and we got about 27.
Gosh.
So I got about 27 symptoms, which is, for me, it was quite sort of confronting. So thank you for just sort of bringing those from a medical perspective. This is what you will experience, and this is what you will see and feel. So how do we deal with this now that the conversation is out there and we're saying, hey ladies, these things are real, this will happen, here's what we can do about it? Because it's I don't know that treatable is like such a bad way of describing something that's so natural, right?
Yeah, it is completely natural, but we are now living to the age of 82 on average, which is not natural. Thank God it's happening, but it's not natural. The average age of death in Victorian times is 59. So we're now seeing the effects of long-term estrogen deficiency on women because, they're potentially living 30, 40 years after their menopause without estrogen, and it causes damage to our health. And that's another problem people don't understand, actually, that low estrogen levels have direct health risks. And we'll talk through that. One little thing I wanted to say, it's actually understanding when you're reaching perimenopause these symptoms, because they can be insidious in onset to start with. The Balance app you mentioned, which is free, you mentioned earlier, is really good at symptom tracking. It's got all those 32 symptoms, and there are more, by the way, but anyway, the most common. And you can track that with your period and see that the symptoms worsen just before your period in perimenopause. And then it can give you a health report that in the UK you can take to your GP, and then the conversation is on the right foot from the start. Let's talk about hormones. How are we going to manage it? And I really real thing is to actually get people, women themselves, society, businessmen and doctors to be proactive in managing menopause now, not just swept under the carpet.
Yeah, that's brilliant. Absolutely brilliant. And I think, I have an episode launched this week, and we talked about menopause in the workplace and how it affects women in the corporate work environment. So that was awesome. I had such amazing feedback. A lot of women moved to tears because they just couldn't figure out how they were going to sustain a career when they had so much doubt and their confidence levels dropped so much, and they just felt like, oh my gosh, someone is talking to me about me, and that I can deal with this. There is a way forward. So
it's cathartic in many ways, isn't it?
Yeah. So I'd like to actually really dive into something that I know very little about, but I am starting to investigate, which is hormone replacement therapy or hormone therapy. So you are a huge advocate for women having information around their options, which is awesome. Yeah. So I am not taking HRT. I'm not saying I'm never going to take it, but I don't feel that I've got symptoms that are unmanageable at this point in time. But that's just my perspective. That's me. I don't know. Maybe I should be taking it. Maybe it would be better if I did. So can you help me understand Under
Yeah.
what situation a woman would be a good candidate for hormone replacement therapy?
So we discussed that the menopause really is a loss of the hormones and the loss of function of our organ, the ovary. So it can be thought of really as a hormone deficiency, much like thyroid and hypothyroidism, low thyroid levels, and we would replace that with thyroxine. And that's the principle of HRT, is simply replacing the hormones that a woman has lost, because that is the most effective treatment of all those symptoms we've just discussed, because the symptoms arise due to a lack of estrogen. So replacing the estrogen gets to the receptor in these organs and ensures better function, and the woman returning back to normal. So women sleep better, their muscle pains at the right dose improve, their mood improves, they can stop antidepressants, they've been misdiagnosed with depression and anxiety, their migraines, if they have migraines, that's a really common problem, will always get worse in the perimenopause. That controls the migraines well as long as the estrogen is given through the skin. And many of their symptoms, and they feel back to themselves, and they are so relieved that they can then function, they can go to work, they don't have to give up their job, there's no financial impact as a result, they're getting on with their lives and their families and everything. So really important to improve quality of life, and really it's the most effective treatment of treating symptoms. Plus, for free, if you treat a woman in the menopause within 10 years of her last period, you will, with HRT, you will halve their risk of heart disease. You will decrease their risk of osteoporosis and treat osteoporosis. The first line treatment for osteoporosis between the ages of 50 and 60, were it to be present. Women won't know if they've got it because it's not painful until they fall and fracture a hip in their 70s or 80s, when it's a little bit too late then. It will help decrease your risk of dementia, type 2 diabetes, and obesity. And we have shown from a really good randomized controlled trial study that actually all causes of death are a little lower on women who take HRT compared with women who don't take HRT. So there's some long-term health benefits. We know that estrogen keeps the arteries soft and supple and helps against blood pressure, atherosclerosis, furring up of the arteries. So it's helpful for that. After the menopause, there's a 5 times increased risk of heart attack, actually. We have a very low risk of heart attack compared with men because we have that before the menopause, because we have that advantage, the biological advantage of estrogen. And after the menopause, our rates zoom right up and completely match the men. And so that is a really important part of the equation of why a woman might want to take HRT. We'd always advocate regulated body identical HRT. That's the gold standard, which means exactly what it sounds like. It's exactly the same copy of estrogen as the ovaries produce and progesterone. So, you're replacing, physiologically perfect. It's replacing like with like. It's derived from the yam root vegetable plant. So it's a nice derivation source, not like the old-fashioned from pregnant mare's urine. So this is a completely different kettle of fish, if you like, to the more old-fashioned types of HRT. And I have practiced medicine for many years, and this is the most rewarding medicine I have ever done because it's transformational for someone, and it can really help their quality of life. And I know that I'm helping their future health as well. I think that is really the key thing about HRT. If estrogen is given through the skin, which we always do, and that's the body identical, regulated body identical HRT, there's no increased risk of blood clots. So people with migraines can have it, people who are overweight, people with blood pressure. It really is very, very safe to have that. What the elephant in the room is people worry about breast cancer. And that was due to,
this is where I'm coming from. I'm like, well, I've been in conversations and people are like, oh no, HRT, breast cancer. And I was like, well, says who and why? And how did we get to that point that where people associate this thing that's going to help women with breast cancer? And now, I mean, like anything could be associated with breast cancer today, right? So can you
Absolutely.
sort of update us a little bit of how did we get
Yeah.
to that conversation? It's like, this is just another way of stopping women from accessing the health needs that are out there, because it kind of feels like that, like a conspiracy theory. But yeah, can you help us with this?
Yeah, absolutely. In 2002, a large study in America was completed, and it was analysed and released to the press before it was peer reviewed. And the headlines were straight away increases the risk of breast cancer and stroke. And it was everywhere, all over the world. And women were frightened, as you would be. Oh, right, off HRT. So women of that generation were affected, their daughters were affected. I was probably about 20 at the time, or something like that. And remember thinking, oh gosh, dreadful. No one's doing HRT. You know, anyway, that's for later on. But it's in our psyche now. It's in the psyche of our generation now, who are now going through the menopause. It was incorrect. It was incorrect. Incorrect statistics were applied to that study, the WHI study it's called, and they have been reevaluated. And in fact, the opposite has been found in many cases. So women who have estrogen only from the WHI, after looking at the correct statistics, applying the correct statistics, and following women up for 18 years now, women who've had a hysterectomy only need estrogen replacement. And they have followed these women up for 18 years, and they've shown actually they had slightly lower risk of breast cancer compared with women not on HRT. Combined HRT, which means estrogen and progesterone, which women with a womb have to take the progesterone to keep the womb lining healthy, there may be a small increased risk of breast cancer. However, not in the younger woman, under 51 I'm talking, but increased risk, looking at all types of HRT, including the old-fashioned mare's urine one, tablet type, and what we call synthetic progesterones and estrogens, there may be a small increased risk of breast cancer, but the increased risk of breast cancer is less than drinking a large glass of wine every night. 2 units of alcohol every night carries a higher risk of developing breast cancer than HRT. Being overweight or obese carries 6 to 10 times an increased risk compared with HRT. So women need to understand that before they close their minds to it, because it, the potential benefits, so many benefits of HRT. Like everything in life, we get in a car, we weigh up the risks and the benefits. No one's telling me don't get in the car to take your kids to school, you could have an accident. Well, of course I could have an accident, but overall I feel it's the right thing to do. So we make judgments and risks. No such thing as risk-free. And a woman has the intelligence to make that decision and understanding when the benefits far outweigh that very potential small risk. And that's a quote from Nice Guidance 2015. The benefits far outweigh the risks in the majority of women. So I think that's a really important message to get across. And actually, the regulated body identical HRT, the progesterone that is used, the natural progesterone, there's been a 5-year study from France saying there's been no increased risk of breast cancer for taking it for 5 years. Now, after that, we need more studies on that to see how long that will last. But I think if you think in general, there possibly could be a very, very small increased risk. But you know what? Once I take HRT, I've got the motivation to exercise and perhaps lose that extra weight. So that's reducing my risk of breast cancer. Maybe I'm drinking a bit too much because I'm numbing my terrible symptoms. And I can actually manage to then, because I'm feeling better from the HRT, I'm in the right mental state to attack my alcohol and bring that down because I'm feeling better. So actually women's health improves because of HRT, because they're feeling better and they can manage their lifestyle, which I'm very keen on, because it's looking at holistically at the woman to make some lifestyle changes. But there's no good saying to the woman who's got serious symptoms of muscle aches and pains, absolute fatigue, no interest, no motivation, I want you down that gym 5 times a week exercising. It's not going to happen. But it might happen if they have HRT. And they can start to think about an exercise schedule into their lives, and they can start to think about healthy eating, and I think it's all about looking at someone as a whole person and and realizing actually how important, and this is an emerging topic now, how important estrogen is for us women. And it's been neglected because sadly women's health has been neglected, and we need more research into the menopause, etc. And we need women to understand that actually these risks, they're not really high risk at all for the majority of women.
Yeah.
And that's important.
Yeah, no, it is important. So I'm sitting here thinking about what you're telling me about HRT and the benefits and everything. If I am not an adverse sufferer of the effects of perimenopause, so I've been able to kind of navigate my way through the last few years with lifestyle changes. Like I made some significant lifestyle changes and I really did see things improve. Should I still be considering taking HRT? Because my estrogen is dropping as well. So
yeah, you should.
Okay, right. You've answered my question. I was not even thinking about it. So that's actually really awesome.
I think you should consider it. You said, should I consider? I think you should, because a lot of women choose to take it for fairly minimal symptoms. As I said, 80% will have symptoms. So 20% really won't seemingly have many symptoms. But a lot of women come to me want to protect their future health. And we know that, yes, it's really important weight-bearing exercises, doing the weights, but actually estrogen is even more effective on bone density and muscle mass and cognition. So it's more effective than the lifestyle changes. So you've got to think about your future health. And a lot of women have normalized so many symptoms that they just suddenly feel better and realize, gosh, I was at 80% actually, and I'd rather be at 100%. I want to live my best life, sort of thing. So I think that's a valid reason. And it has to be an individual decision. And everyone's circumstances are slightly, obviously, very different. So it's a discussion with your healthcare practitioner about it.
Yeah. Well, you've completely nailed it on the head for me. Absolutely. I mean, and I think, I have a few sort of other really good friends that are also in the fitness industry that would be at a similar level, that we go, we're dealing with it. I've got a lot of friends
in the fitness, and I don't see why there should be an argument, HRT or natural, or lifestyle. I'd say I would advocate both. They're not mutually exclusive. Get your hormones right. We know that that's going to be doing a wonderful job on the heart and the arteries and the bones. And then we can enhance that by doing weight, resistance training to enhance that, and eating healthily, plant-based diet, if you like, 5 portions of fruit and vegetables anyway, sensible eating, alcohol in check, all this lifestyle is really important. Mindfulness, exercise, good for the mind, and anxiety, etc. It should still be done. Yoga, a lot of people find that really helpful as well. So I think why not have everything? You don't have to have, it's not an either or. You can do everything.
You can have it all.
You can have it all, but the most effective. Don't be thinking that just muscle training, which will really help the mental aspects of life and the menopause. It won't. It's not effective on the bones as estrogen. It's just like a treatment.
It's so good to know. Yeah. I mean, my personal goal is to have the next 50 years feeling as good as I do today, but I'm not taking HRT. So I'm thinking, well, hang on, why not? Why shouldn't I?
Another option is try it and see how you feel. You can stop it if you don't like
just writing it down. I'm going to add that on my list of things to do to set up my life in New Zealand. So because I've got like house check, school for son check, and now me.
Yeah, but why don't you put you to the top of the list for a change?
Oh, yeah, good point. Yeah, because we don't do that, because we're those women that don't. Yeah, we don't do that.
I know. This is the problem. So I think there's many benefits of HRT, and not to be frightened of. I'm afraid 1 in 7 of us are going to get breast cancer. 90% curable now, which is great news. But so clearly, women who take HRT will get breast cancer, but for the vast majority, they would have got it anyway. That's it.
Yeah,
The tiny little extra risk from HRT is a splash in the ocean compared with, vast majority of cases.
Yeah, thank you so much. I mean, this has been so enlightening. I mean, it's the one key area of all the research and study that I've done, people I've had conversations with, and of course the interviews and podcasts, to help my woman friends out there understand, what's going on and how we can continue to live our best lives. I just want to also give a really big shout out to your app, the Balance app. I downloaded it about 8 weeks ago, and there's some really good and easy to follow information there on what's happening to your body, how to track your cycle, how to pay attention to these symptoms that you've mentioned. So how did that come about, the app? What got started? You lying in bed at night thinking, I think I'm going to do an app. How did that work out?
Although I'm a director of the Balance app, it's Dr. Louise Houston. It's her brainchild. She's as you know, she is the pioneer of menopause care, and I'm privileged enough to know her as a friend and work alongside her as a director. But anyway, so she started the app, and we all came on board. It's such a brilliant idea, because we know what women want, because we see so many. We know what we hear the same stories, and it's heartbreaking, actually. I think women really are a power. Women help women. It's such a force. When women feel better, they don't want others to suffer like they have, and they really can improve things. So it's free. So have a go. It doesn't matter if you don't like it, but it's free. And there's a community to talk to, which I think women find really helpful. Women like to talk. It's good. And there's evidence-based, non-pharma funded. There's no pharma industry involved with this. Evidence-based medicine available about HRT, about all sorts of things. Very, very informative, and useful things about diet, recipes, exercise, etc. So alternatives as well. Not everyone is HRT as a first-line treatment. So that's important. So obviously an individualized consultation is needed with a healthcare professional, but for the vast majority of women can safely take HRT. Certain cases it may not be first line, for example, estrogen receptor breast cancer. But it's all about the individual making their choice, an informed choice, and that's all. Is the main thing I worry about is it informed? Then that's fine. If a woman is informed, that's fine. And it's having those conversations with your healthcare professional. But unfortunately, even healthcare professionals, certainly in the UK, there's been so much misunderstanding about HRT, even in those quarters, because they haven't been taught properly. Not their fault. It hasn't been there. The education hasn't been there. And really, Louise Houston has really helped that and helped inform and educate, which I hope will see a change in the approach.
Yeah, I feel like you've hit the nail on the head there, because I feel like it's women who are going through menopause that are sort of creating this tide of we want information, and then their doctors are like, well, I don't know what to give you. I've got to go find out, or we find out ourselves. This is what's happening. So I think the women ourselves in this age, this generation of women who are like, I need information, I need it now. I know I should feel better than this. We are accelerating the conversation. It'll be amazing. I'm really looking forward to the all industries, medical wellness, fitness, everything, to get on board with how to make women live their best life, how to help them live their best life. Yeah.
You and me both. That's absolutely what I want, and we will achieve, I'm sure.
We will achieve it. Yeah. I think that, 10 years from now, everyone, it'll just be a normal conversation. We talk about puberty, and then the bookend is menopause, and then we'll be having the same conversation. Oh, it'll be general. You need to do this, and this. Very easy.
Like antenatal care, there was no such thing in the Victorian times. Now you're pregnant, it's managed, because we know the benefits. This is, we're now talking about menopause is now on the curriculum in the UK. So we needed to be talking with our daughters, and
Yeah.
it's not taboo, it's not shrouded in secrecy. And young women have it. It's not an old woman's problem. It's all ages, etc. Really, yeah.
Yeah. So just a funny way to sort of wrap up our conversation. So I have a 16-year-old. So she's going through
Hormonal.
puberty, or has been for, since she was 12, and I was going through perimenopause when she was going through puberty. So she tells me and sends me text messages and Snapchats that her girlfriends' mums are listening to my podcast.
Yes.
I'm like, yeah.
With my daughter, yeah.
Yeah. She's like, oh, so and so is loving your podcast, mum, and I don't think she has any idea what it's about. So, yeah.
I know.
Hey, thank you so much, Rebecca. It was fantastic to have you. I know so many people are going to just be so informed and enlightened around their options, and I think that's what's really vital here, this conversation.
Good. Well, absolute pleasure, and thank you for inviting me. It's lovely to talk to people on New Zealand as well.
Yay.